Addictive disease for beginners.
What's all this rubbish about addictive disease? Those behaviours are just bad habits.
They're significant illnesses, sometimes with high mortality rates, from medical consequences such as cancer, heart attacks, liver disease, or suicide.
They're made-up conditions, excuses for bad behaviour.
I believe that all addictive diseases to substances or behaviors or relationships are very real. They're diseases of the human spirit, probably caused by defects in neurotransmission systems with the mood centers in the brain.
How do you reckon that works?
I believe that we addicts are born with an inner sense of inexplicable emptiness. In due course, we discover for ourselves that some substances and processes, in particular types of relationship, lift our mood so that we feel okay.
Surely that happens with pretty well everybody.
Well, in our case, the effects wear off. Our default position is one of depression. Something's wrong in our neurotransmission systems, so that we always feel in a -1 state. So we go looking for +1s. When we discover them, we don't want to let them go.
Then you need antidepressants, or maybe you should take exercise, or do some work.
All of that can be addictive to us.
Antidepressants aren't addictive. Nobody craves for them.
Their withdrawal effects after 2 weeks can be very severe. Anything that acts on the mood centers can be addictive to anyone who has an addictive nature.
We all have the potential for addiction if we're stupid enough.
No, only about 15% of the population have addictive natures, but we tend to form relationships with each other because we feel instinctively understood. As a result, a small genetic pool takes over.
No, I'm not buying any of that. I'm a doctor. Addiction is not a disease of any kind. There's no blood test, x-ray or scan that can prove it.
Let's look at your concept of disease for a moment. Would you say that schizophrenia or bipolar disorder are not real diseases because there's no test to prove or disprove their existence?
They're diseases of the mind, and we treat them effectively with mind-altering drugs.
Are the drugs really effective and free from damaging side effects?
Of course they are, although we have to find the right drug or combination of drugs and the right doses.
There's significant evidence from long-term follow-up studies in Minnesota that schizophrenia often improves simply with time.
I've never seen that.
When patients are given a stable home and some form of basic employment, they gain increased self-esteem and many of them function very well.
That's certainly not true for all of them. Anyway, doctors can't provide those things to everybody. It's not our job.
Patients diagnosed as being bipolar are often found to have mood swings due to alcoholism or other forms of addictive disease.
Well, some of them may drink a bit too much sometimes.
And children diagnosed with attention deficit disorder often grow up to have addiction problems. ADD may be the first sign of an addictive nature. It's not surprising that it improves when treated with amphetamines.
We have to treat patients who are acutely ill.
Addicts are often acutely ill.
The problems are self-inflicted.
Are you going to refuse to treat all people who smoke cigarettes, or overeat, or drink alcohol, or take drugs? There'd be little work left for you to do.
Patients need to take care of themselves.
Well, supposing they can't.
Well, that wouldn't be true for addicts of any kind. They're perfectly capable of looking after themselves, unless they have heart attacks or take overdoses, that sort of thing.
So a doctor's job is to treat the consequences of a condition, but not the cause?
The cause may be social or even political, and that's nothing to do with us.
Would you spend time with people who are depressed because of unemployment?
Yes, clinical depression is real. People can't help that.
People can avoid being injured in sports. Would you treat those injuries?
Of course I would, but I resent people asking me for help over things that are a personal responsibility.
Such as contraception?
That's different. I mean, I don't like wasting my time on people who have purely emotional problems.
Like those who've been bereaved?
You're being very difficult about this. I'm telling you that addicts of any kind get themselves into the mess they're in, and they can perfectly easily get themselves out of it. They should stop doing the stupid things that they do. Then all their problems will go away.
As if they had a virus infection.
No, some viruses have very serious medical consequences.
So do many addictive behaviors, such as alcoholism, drug addiction, nicotine addiction, and eating disorders.
I know that perfectly well. All these people need to do is to stop doing stupid things and going too far. They should learn to use their addictive substances, or behaviors and relationships, if you insist, sensibly and in moderation.
What if they can't do that?
Of course they can. All they have to do is follow the sensible advice that we doctors give them.
They can't hear it,
They've got ears.
but not clear minds behind them. That's the nature of their illness.
Addiction isn't an illness. It's a stupidity, a lack of self-discipline, a depravity.
I know many distinguished men and women who have addiction problems of one kind or another.
Then they must have had difficult childhoods or unhappy home lives.
Some did, but certainly not all of them.
Then it means that they brought it on themselves, and they can stop whenever they want to.
That isn't their experience or mine. Those of us who have addictive natures seem to be born that way.
That's just a rationalization, an excuse.
No, it gives us the responsibility to take it into account each day.
Then just stop.
Despite our determined efforts, we can't stop until we acknowledge our weakness and ask for help.
That's ridiculous.
Maybe so, but that's what works. We realize that we cannot help ourselves until we realize that we cannot help ourselves.
Huh?
Yes, Paradox is explained when we recognize that we aren't strong enough to sort out an addiction problem on our own. We need something more powerful than our own willpower.
There's no such thing.
Yes, there is. For example, the power of a group of people who found that working alongside each other achieves what they couldn't have done on their own. Alcoholics get well when they join Alcoholics Anonymous and work the 12-step program.
But that can't work in behavioural things, such as what you would call workaholism, or shopaholism, or compulsive gambling and risk-taking, or exercise addiction, or so-called sex and love addiction, or any of these silly things that you dress up as diseases.
Yes, it can. Abstinence can be from using the behavior addictively rather than for its primary purpose.
What's addictively?
Using the behavior as if it were a drug, getting an instant hit without thought to damaging consequences or to the effects on anyone else.
And what do they do then?
They get progressively more pain of one kind or another: physical, emotional, marital, social, financial, legal, educational, and so on.
More fool them.
Only addictive behavior has such widespread consequences. That's one of the ways it can be diagnosed. If a man has lost his job, his wife, and his driving license, it's almost superfluous to ask about his alcohol consumption.
That's very judgmental of you. We all like a bit to drink.
Not to the point of being horizontal. We start to counter our denial, the psychological part of our illness that tells us that we haven't got it, when the pain of continuing as we are is greater than the perceived pain of changing our behavior.
But doctors and families have to help people who are in pain.
Bailing out addicts from the consequences of our behavior enables us to continue. We don't give up until we have to.
So you leave people in pain. What sort of help do you call that?
The opposite of compulsive helping, which is an addictive illness in its own right. You see it when people do too much for others, leading them into a dependency trap, and not enough for themselves.
That's extraordinarily selfish.
Yes, it's in our self-interest to be genuinely kind to other people, rather than smother them, belittle them, or patronize them.
But that would undermine the basic beliefs of a compassionate society.
No, it doesn't. It shows respect for people's capacity to help themselves when they're physically and mentally capable of doing so.
That's what I said. Addicts should sort themselves out.
Often they die before they can do that. They need help, but their compulsive helpers, there's at least one behind every addict, need to be peeled off first.
That's what you call tough love, is it?
Yes, it is. It's equally tough on the addict and the helper. Each has to learn new behavior so that they can live happily and constructively, free from their addictive behavior.
But in my experience, addicts always relapse.
Yes, the genetic drive will always be there, which is why we counter it by doing 5 things. We go to meetings of an appropriate anonymous fellowship, such as AA, in order to counter our denial by observing and listening to other people who are like us. Each day we work the 12-step program first formulated by AA. We get a sponsor from within the fellowship to guide us. We read fellowship literature each day, and we stay abstinent from all our addictions, leaving nothing still active.
My God, it's a religious cult.
I myself have no religious belief, but I have learned that I'm not God. My ideas are not cast in stone. I still have a lot to learn.